Have you ever wondered what daily masturbation really does to your prostate? It might sound like a bold topic, but it's one that deserves real attention, especially for men over 50 who care about staying healthy and informed. In today's video, we're diving into the science, busting some common myths, and sharing what experts know about how masturbation might affect your prostate. So, if you're curious, confused, or just want straight answers without the fluff, you're in the right place. Hit that like button, share this with someone who needs to hear it, and subscribe for more no-nonsense health content. What is the prostate anyway? Let's start simple. The prostate is a small gland, about the size of a walnut. It sits just below the bladder and wraps around the urethra. Its main job? Producing the fluid that mixes with sperm to make semen. This little gland plays a big role in male fertility. But as men age, it often becomes a source of health problems like BPH, that's benign prostatic hyperplasia, or an enlarged prostate that can cause urinary issues. Prostatitis, inflammation that leads to pelvic pain or discomfort. And of course, prostate cancer, which becomes more common as we get older. With all these potential issues, it makes sense to ask, how does something as common as masturbation fit into the picture? So, is a masturbation good or bad for the prostate? Let's look at what the science says. The potential benefits of regular ejaculation. Several studies suggest that regular ejaculation, whether through sex or masturbation, might actually protect your prostate. For example, one study published in the Journal of European Urology found that men who ejaculated 21 or more times per month had a lower risk of developing prostate cancer. Why might that be? Well, regular ejaculation could help flush out irritants and toxins from the prostate, reduce inflammation, something that contributes to many health problems, boost blood flow in the pelvic area, keeping tissue healthy, and maybe even improve urinary flow by reducing pressure in the gland. Are there any downsides? For most men, masturbation is safe. But like anything, if it becomes excessive or compulsive, there could be some issues. It might cause stress or guilt if it interferes with daily life or relationships. Too much aggressive activity could lead to pelvic discomfort or irritation. And in some cases, it may reduce interest or satisfaction in partnered intimacy. Bottom line, it's not the act itself. It's about how and why you're doing it. Can daily masturbation damage the prostate? In most cases, no. Daily masturbation is not harmful to the prostate. In fact, for many men, it can be part of a healthy routine. That said, if it starts interfering with your well-being or relationships, it might be time to check in with yourself or talk to a healthcare provider. Mental health counts, too. Ejaculation releases endorphins, those natural feel-good chemicals. They relieve stress, improve sleep, and lift your mood. And because stress increases inflammation, that can also help your prostate indirectly. But remember, if you're using masturbation as a way to avoid dealing with stress or emotional pain, that's a sign to get support. Mental health and physical health are always connected. What about hormones? Here's the deal. Testosterone is the main male sex hormone. In the prostate, it's converted to DHT or dihydrotestosterone. DHT is important, but too much of it has been linked to prostate enlargement. Some experts think that regular ejaculation may help regulate hormone levels by keeping production and release steady. That's another reason why moderation may support long-term prostate health. Tips for a healthy prostate. Whether or not you masturbate regularly, here are a few simple ways to take care of your prostate. Drink plenty of water. Eat foods like tomatoes, green tea, berries, and omega-3s. Stay active. Exercise helps circulation and reduces inflammation. Get regular checkups and PSA tests, especially after age 50, and avoid smoking or heavy alcohol use. Let's bust some myths. Myth 1. Masturbation causes prostate cancer. False. Studies show it might actually reduce the risk. Myth 2. It lowers your testosterone. False. Any drop is short-term and won't hurt your hormonal balance. Myth 3. It can damage your prostate. False again. Unless it's extreme or physically harmful, there's no evidence of long-term damage. Quick Q&A. Q. Does masturbation frequency change with age? Yes, it often does. Hormones, health, and lifestyle all play a part. But there's no one-size-fits-all number. What matters is how it makes you feel. Q. What about prostate massage? It may help with BPH or prostatitis symptoms for some men, but talk to your doctor first. Q. How does stress affect the prostate? Chronic stress raises inflammation and lowers immunity. That's bad news for your prostate. So things like mindfulness, therapy, and exercise can really help. Daily masturbation, when done in moderation, is generally safe, and it may even offer benefits for prostate health. As always, balance is key. If you're noticing symptoms like frequent nighttime urination, pelvic pain, or a weak stream, don't ignore them. Talk to your doctor. Early action is the best defense. If this video helped you out, don't forget to like, share, and subscribe for more practical advice on men's health, psychology, and wellness. Got questions or your own experience to share? Drop a comment below. We'd love to hear from you. Your health is your wealth. Take care, stay informed, and remember, knowledge is power.